How long do you need mechanical ventilation after a lung transplant? My name is Patrik Hutzel from IntensivCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence so that your loved one always gets best care and treatment, even if you're not a doctor or a nurse in intensive care. So today's question that I want to talk about is how long do you need to be on a ventilator after a lung transplant? Because it's a question we get from families in intensive care who have a loved one in intensive care after a lung transplant. So now let's break this down, because the length of time someone needs mechanical ventilation after a lung transplant can vary significantly depending on a number of factors. Let's look at number one, which is a straightforward lung transplant. In the best case scenario, when the lung transplant surgery goes smoothly, the donor lungs are a good match and there are no immediate complications such as rejection or infection. Patients may only need mechanical ventilation 24 to 72 hours. In some cases, it can be extubated, having the breathing tube removed within the first couple of days after surgery, and that also includes if pain is well controlled. So now I have worked in critical care nursing for over 25 years in 3 different countries, and I've looked after a number of lung transplant patients during my time working in ICU. And I can confirm that if it's straightforward, pain is controlled, no infection, no rejection, 24, sometimes even less than 24 hours in the best cases. Next, let's look at number two, not having the perfect donor lungs. Unfortunately, not every patient receives quote unquote perfect donor lungs. Sometimes the lungs are marginal or have limitations due to the donor's condition. In these cases, the lungs might take longer to function optimally, and your loved one may need ventilation support for several days to a few weeks until the lungs recover. Number three, when complications occur. Complications such as primary graft dysfunction, also known as PGD, bleeding, pneumonia, or organ rejection can significantly delay the ability to wean off the ventilator. In such cases, ventilation support may be needed for a few weeks, and then also a tracheostomy is often necessary. Let's look at number four, which is ECMO support. For some patients, particularly if the transplanted lungs are very weak in the beginning, ECMO, also known as extracorporeal membrane oxygenation, may be required. ECMO, in essence, takes over the function of the lungs and sometimes the heart temporarily, giving the new lungs time to recover. Patients on ECMO often remain ventilated for longer, sometimes several weeks, depending on how quickly their lungs adapt and start functioning independently. Let's look at number five, which is a tracheostomy after lung transplant. If your loved one cannot be weaned off the ventilator after a lung transplant within the first 1 to 2 weeks, a tracheostomy is often considered. A tracheostomy provides a more stable and safer long-term airway compared to prolonged intubation. And if your loved one, even after a tracheostomy, cannot come off the ventilator after many weeks or sometimes even months, I have seen patients with a tracheostomy after lung transplant being in ICU for many months. Here is where you have another option. If your loved one ends up with a tracheostomy and ventilator dependency after lung transplant, the intensive care team may want to send them to intensive care at home, because sending them out of ICU within the hospital or to a rehab facility, or if you're in the US, to a long-term acute care facility is not an option. It's not a safe option anyway. Instead, you should look at intensivecarehome.com, where we provide specialist home intensive care nursing services so that your loved one can continue to receive ICU-level care at home rather than in a hospital or nursing home. Families at home have real peace of mind and, most importantly, quality of life, knowing that their loved one is looked after 24/7 at home with ICU-trained nurses. So let's summarize everything that we spoke about in this video. So how long do you need to be on a ventilator after lung transplant? Number one, straightforward cases, 24 to 72 hours. Number two, non-ideal donor lungs, several days to weeks. Number three, with complications, potentially weeks. Number four, if ECMO is needed, weeks or longer. And if unable to wean with a tracheostomy, if unable to wean in general, tracheostomy might be required. And intensive care at home is an option. Go and check out intensivecareathome.com. Always remember, every patient is different, and the ICU team may sometimes paint a quote-unquote doom and gloom scenario. Don't accept everything at face value. Educate yourself. Ask the right questions. Get access to the medical records as soon as possible, and get the right level of support, which we provide here at intensivecarehotline.com with our consulting and advocacy. We have turned many situations around very quickly with our consulting and advocacy. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.